everyone. I'm Dr. Apurva Prasad, consultant spine surgeon and neurosurgeon performing brain and life surgery at Surya Hospital in Mumbai. So this talk is about the spinal problems in children. These spinal problems can either be since birth, which we are mainly looking at in today's talk, and the second aspect of spine issues are in lifestyle modifications which children acquire through their life. So why do we talk about these spinal problems, how common they are, is that as compared to the rest of the world, in India the incidence is quite high. So out of every 1,000 children who are born in India, who are live born, around 10 to 11 of them will suffer from these problems. So definitely this is a issue which needs to be addressed to. And today I'll be clearing some of the myths and some of the facts which we should know about these spine issues. So the first question which arises is who are these children and how do we identify them and who is expected to have these problems. So these problems begin not after birth but before birth, and the most common cause of these issues is in children is in mothers who do not have a proper nutrition during their pregnancy. The most common identified cause of children who have these problems at birth is because of inappropriate folic acid supplementation in pregnant mothers, and therefore it is very important for the expecting and the pregnant mothers to follow up and to have regular visits with their physicians, with their treating doctors, and to get the proper scans done and the medicines to be taken which is advised to them as and when necessary. So, because this folic acid supplementation is something which is completely avoidable, and if taken appropriately, these disorders which are usually present at birth can be completely avoided, and the child has a very normal life without these issues. The second most common risk factor is that in mothers who are expecting and who have some infection during their pregnancy, the children may have these problems because of that. In mothers who are going to the fields, who are working in a poor socioeconomic status because of some infection, because of exposure to some poisons, to some toxic chemicals, these problems can occur in children who are being born from such exposure. So therefore, we have a very high incidence of exposure to, in people who are from lower socioeconomic background, because these children and mothers do not have ready access to healthcare and do not have ready access to the medical facilities which are at disposal to us. So these are the risk factors, and these are the children and the mothers who need to be very stringently followed up. And the second question is that how to identify these disorders and what are these disorders. So when we talk of spinal problems which are present at birth, these are basically divided into into two main categories. One is the open defects and one are closed defects. So open defects are those in which the skin over the back is absent, and closed defects are those in which the skin over the back is normal. So these problems usually occur at birth and are most common at the lower back. And in children, the second most common site is the neck. So if there is no skin above the pathology, if there is no skin at the above the swelling, it is called as an open defect, and these problems are emergencies, because if not treated, this can lead to an infection in the spine. This can lead to a very disastrous effect in the child. So the problem is that once a child is born and has a swelling in the back, or if the child is born and there is some fluid which is coming out from the back, we need to be very emergent and very cautious, and the child needs prompt treatment. If there is no defect, no obvious problem on the back of the spine, and the child seems to be normal, then these defects are difficult to identify because there is no clear cut sign. And in these children, we have to watch for the other signs, like the most common three parts of the spine which are affected in these children is the first is the legs. In the legs, the child may not start walking normally at the age of 1 year, and this is the time when most of the patients get these children to the doctor because the child is not started to walk, or the child falls frequently while walking even after 1 to 2 years of age, or the child has some difficulty in making the leg straight, or the leg is very, very stiff, or the problem is that sometimes the child cannot bear the weight on the legs, or the legs are inverted in inward fashion. The second problem is the problem of urine. Normally, a child should be toilet trained by the age of 5 years. If the child does not have that control over urine and his motion by the age of 5 years or maybe 6 years, then that is indicative of some underlying issue which has not been diagnosed. So if the child has a problem in walking, if the child cannot bear weight, if the legs are very stiff, the child is walking on his on his toes or on his heels, or if the child is not continent and has bedwetting even after the age of 5 to 6 years, one should consult an expert, a neurosurgeon or a pediatrician, to ascertain what is the cause of these issues, because these need to be treated. So now we have some questions for which I would be addressing. Mr. Richard Chadha has asked, how do I know if the child has a spinal injury? So spinal injury is usually either a low force or a high force. If the child has had a fall, or if the child has had a jerk, or if someone has hit the child, then the most common sign of an injury is local pain at the site where the child has been hit, or where the child has had the impact, and the pain may radiate. It may, if the child has a injury in the upper part of the spine, the pain may go to the hands. In the lower back, the pain may go to the legs, and the child has a lot of pain on touch over that part. And if the motion of that part is severely restricted, if on moving the child has severe pain in the back, then it is indicative of an injury which needs to be addressed. Children keep on falling, children have multiple small injuries throughout the day, but if any deficit persists for more than 2 days, then that is the time when we should try to know what exactly the problem is. So pain, tenderness, decreased motions, and constant pain, which is not allowing the child to be comfortable even at night, are things which, you know, help us diagnose that, yeah, the child has had a spine injury and it needs to be treated. The next question is, at what age do pediatric spine disorders start to present themselves? So as I just said in the video previously, you can go, the spine disorders mostly are present at birth, and they can be either very, very obvious and visible, or they can be covert, which are not very, very easily determined at birth. And if they are not very easily visible, then the age between 1 year to 5 years is the time when we need to see and look for signs, which I just said, to know if underlying pathology lies in the spine or is it a local pathology. The next question is, what is the most common congenital spinal defect? So, as I said, the umbrella term for these spinal defects is neural tube defects or spina bifida. In the open category, the myelomeningocele, which we have a term in the medical science, is the most common. In the Crow's defect, it presents only as a swelling in the under the skin, which is called a lipoma. And there are many other secondary evidences if there is an underlying problem in the spine, like the child may have a patch of hair at his lower back, his buttocks may not be symmetrical, there may be an asymmetrical cleft or a depression in the spine, there may be a sacral dimple, which is a depression over the bone of the buttocks, or there may be some hyperpigmented patches or a black patch over the buttocks, which indicates that there is some problem underneath which needs to be treated. The next problem is, can spine problems cause dizziness? Usually, no. In children, spine problems do not cause dizziness. If it is a very, very high, so in spine, we have the cervical, the lumbar, and the lower down spine. So if a child has a problem in the cervical spine has 7 bones. So if the problem is in the high cervical, where the neck joins with the skull, that is at the junction of the head and the neck. If a child has a problem, a bony pathology at that part of the spine, yes, then it may cause dizziness. A problem which is lower down usually does not cause dizziness. The next question is, should I worry if my child has scoliosis? So see, the scoliosis is a curvature, abnormal curvature of the spine. Our spine normally has a curve. Our spine is not straight like a bamboo. Our spine has some natural curves which is present in every human being. When these curves become abnormal, either sideways or elongated or from front to back, then we use the term scoliosis or kyphosis. If the child has scoliosis, that means the curve of his spine is abnormal, and many of the times these children do require some intervention. But the age at which the intervention has to needs to be done is not at a very young age, because we need the bones to allow to grow to their normal time. Normally in children, the bony fusion, the normal growth of bone, is complete by around 12 years of age. So if at all any intervention is planned, it is usually planned after 12 years, but that does not mean that the child does not need treatment before that. Before that, we have non-operative interventions like giving the child a jacket, giving some physiotherapy, giving some exercises, and we need to investigate the child with an MRI, or if required, a full body X-ray to ascertain why this scoliosis has happened. So you should not worry, but you should get treated. The next question again on scoliosis is, does childhood scoliosis go away? So as I said, now scoliosis can be idiopathic, that is, there is no reason for the child to have that scoliotic deformity, or sometimes the scoliosis is because of some syndromes. So if a child has syndromes, the most common syndrome with scoliosis associated is neurofibromatosis. If a child of neurofibromatosis type 2 has a scoliosis, more often than not, they do not go away on their own, or they need some correction. Even if the child has a scoliosis since birth, as I said, it does not indicate an emergency treatment. We have to wait for the child to at least achieve an age of 12 to 13 years, till the time the normal bones have grown. And after that, a decision has to be taken whether this scoliosis will go by its own, or is it causing some issue, and then it needs to be treated. If there is scoliosis but the child absolutely has no problem, then we have to weigh the risks and benefits of surgery, and then an informed decision has to be taken. So, how are spinal problems diagnosed in children? I have just elaborated on the symptoms and signs which we should look for in children in at the time of birth and in adult children. So, the first part of my video has dealt with the diagnosis of the problems in children. So, I'll skip the question for now. Uh, when do the next question is, when do kids get checked for scoliosis? See, scoliosis is not something which you have to get your child checked for, as a like we get others checked for some diabetes or blood pressure. If the child has an abnormal hump on his back, if the curvature of his spine is not normal, if the child does not stand straight, if the child is drooping forward, in these cases, if a parent observes or sees that the back of the child is not in the center, but it is to the side, that is the time when you should consult an expert and get your child checked for scoliosis. What are the common spine disorders? So this lecture deals only with the pediatric spinal disorders. So I will only, as I have said already, the most common spinal disorders in open as well as closed defect. So we will skip this question. Symptoms of spinal problems in kids we have just discussed, and the problem in the legs, the problem in urine, the problem in passing motion. One more symptom which sometimes gets under noticed is that the brain and spine are a complete part of the cranial nervous system in the humans. So any proper pathology or problem in the spine is bound to affect the brain. So many a times the child needs a very acute intervention, not only in the spine but also in the brain, because both are connected. If there is some problem in the spine, there is some infection, there is some outpouching, a mass which is present in the lower back, it causes secondary changes in the brain. And actually, this is how the spinal problems in pregnant mothers having children is identified. Because the problems which are present since birth, the secondary effects on the brain can be seen in a sonography. So that is why many a times the presenting complaint of a spinal issue can also be an increasing size of the head in the child, or the child may be very, very irritable. The child may keep banging his head, or the child may be crying inconsolably and not stopping. So sometimes these issues, which are secondary effects of a spinal problem, causing damage to the brain are brought into the notice. And then in a retrospect, we diagnose that the problem pathology lies in the spine, which is causing a secondary problem in the brain. At what age can scoliosis be corrected? As I just said, usually till 12 years we wait because the normal bones have to fuse, and once we allow for the normal fusion to occur, which is not going to get corrected after 12 to 13 years of age, that is the time when we decide that, okay, the child should now be taken for surgery if required. So now we go on the management part of these children, and to diagnose these problems, the investigation of child is always an MRI, which includes an MRI of the brain with the spine, because as I just said, that these disorders are affect both the brain and the spine, and an entire screening of the nervous system has to be done. Now, when we come to the treatment part of these problems, when a child has a spinal issue and it needs to be treated, whether it is a child who is just born and has some defect, skin defect, or a child has the nervous tissue or the lower part of the spine not completely inside the skin and has a fluid coming out from his back at birth, or if it's an elective surgery in a child who is maybe 5 years of age and has severe back pain and cannot walk straight and the pain in the legs is unbearable. In both the situations, when a child comes to a hospital, even in our hospital here at Surya Hospital, it's not a one-person job, it's a team effort. So the team usually involves five people, which is a pediatrician, a pediatric orthopedic surgeon, the neurosurgeon who does the surgery, a urologist who takes care of the urine and the stool problems if at all it's there. And sometimes we need the help of a plastic surgeon because if the defect of the skin over the back of the child is very large, we need sometimes a plastic surgeon to close the skin so that the infection from outside should not go inside. That is the end point of surgery, that all the nervous tissue, all the nerves should be completely inside within the normal confines of the bone in the spine, and the above layer of muscle and skin should be completely intact. So it's always a multidisciplinary team approach, and a team treats the child. It's not a one person who runs the show. Every person has a separate and a very, very equally important job, and everyone does their job to the best so that the child can have a normal growth post surgery. The second part is once these children are operated and once these children undergo surgery, what to expect. Many of my patients ask me what after surgery, once we get the child treated, will the child have a normal life? So in children who are operated at a later stage, maybe after 3 years or 4 years, for defects which are not so obvious and have been diagnosed because the child has some problems, because it's a planned surgery, the outcomes are usually very nice, and the child usually does not have any defect after surgery, any problem. In children who are operated immediately after their birth, maybe on day one or day two, because they have a leak from the spine going on, the skin over the spine is not intact. In those children, in the absence of any other congenital abnormalities, if the child is not syndromic, if the child does not have any severe secondary effects in the brain, in those children, the development is of varying degrees, and usually these children have a 20 to 25% chance of an intellectual decline in their life. So the child survives, the child is all right, but 20-25% of these patients, because of the exposure of the spine to outside at a very young age, may have an intellectual decline. And as the child grows, as we see the developmental milestones of the child, it becomes more and more clear as to how much has the child been affected and what modalities of his functionalities are normal. When we assess a child, it's not only his motor skills, as in the movement of his hands and legs and the neck. It's motor plus it's a language skill, plus it's the social interaction of the child, the developmental milestones which the child has to achieve as the child grows up. So when the child is just 1 day or 2 day old and has to be operated, it's too early a time to predict and to guarantee whether a child will be 100% normal. But most of these kids, 80% of these kids do have a normal life, with only a very small part having persistent problems, which is around 20%. When we talk of the prevention of this, so as I said, these issues in children which are present at birth are completely preventable, and the most important thing is all pregnant mothers should go and visit their physicians, their gynecologists, These and the routine sonography scans, which are advised by the doctors, must be done because the scans can pick up these abnormalities at a quite early age. The folic acid and the dietary supplementation, which is advised, which is the most often neglected by mothers, is the cause which causes these issues. So if we can, as we always say, prevention is better than cure. So if we can prevent these disorders, which are actually preventable, then we have a very good chance of having a very normal child. And we still have the if we know at a very early stage that the child has these issues, then an informed decision can be taken as to how to plan the next step. So the next thing is about when these problems occur. So usually the three aspects which get involved is the spine and the meninges, which are the covering of the nerves, and the nerve itself. So that is why a child may have only one modality involved and not all the three of them. And if it's only the nerves, then the child will have an excruciating pain in the back or in the legs, or one leg may be small, shorter or longer than other. So these are some things which help us identify as to what the problem is and how we have to deal with them. Now, one question which we have is, can spine problems cause breathing problems? Okay, so as I said, as was the case with dizziness, spine problems can cause some breathing issues when the problem is affecting the cervical spine, which is the spine in the neck. If the child has a high cervical problem at the junction of the neck and the head, or if it is somewhere between the third and the fourth cervical vertebrae, then yes, the child may have breathing problems because of the spine pathology and it needs to be treated. The next question is, how do you fix scoliosis in children? Okay, so if scoliosis fixation is at all needed, is as I said, but repeatedly done at a later stage, which is around 12 to 13 years, depending on whether the child needs it or not, depending on the clinical examination. It's not the scan which needs to be treated, it is the child which should be treated. And if scoliosis needs correction, then in that case, because the spine is not straight, the aim is to make the spine straight so that the growth of the child happens in a proper way. And once we achieve a correct alignment of the spine in a straight fashion, then the child is okay. For fixation, usually we need instruments, we need screws to fix the spine, we need implants which are fixed into the spine to treat the child, and that is how this surgery is done. In these surgeries, usually the number of levels which are fixed becomes quite long because the entire spine is curved and it needs to be corrected. So at Surya hospitals, normally my OPDs are 2 days in a week on Wednesdays and Fridays. So any child who is suspected by the parents to have some spinal problems can definitely come to the hospital. And as I said repeatedly, it's not a one-man job. Once I see the patient, and if the patient definitely needs surgery depending on the problems which the child has, and if it matches with the investigations which we do, most commonly the MRI or the CT scan if required, then our team takes care of the child as a whole and all the aspects of surgery before and after, and what exactly are we looking at and why the child needs surgery, and what are we looking at if we don't get operated. This counseling and this information is given by the entire team so that the child and the parents can make an informed decision. In Surya hospitals, we have successfully treated many children having these birth defects at birth, or even in children who have presented later to us at 5 years and later. And not only pediatric, but we also have success stories of adult patients now being treated at Surya hospitals. And I would request all the parents who are here, and I would thank them for the questions, and I would thank Surya hospitals and congratulate them for this awareness program. And I would request everyone to not ignore these problems. The lifestyle problems are a separate aspect, which now we know that the schools have started the children carrying weight on their backs in their bags. So many of the children are coming now with muscle spasm and back pain. So all these issues should be addressed. It should not be ignored. And if any child has any problem in the legs or the lower back, it more often than not indicates some issue in the spine, which should not be ignored. So I thank everyone for the questions and for attending the live interactive session. Thank you so much.